thank you for joining. Today we're going to do 30 minutes on movements for our spine, so the upper back and the lower back, kind of our foundation. So we've got about 10 moves, and we can either do them dynamically or we can do the stretches statically, so it's up to you which feels good. Sometimes it's nice to start them dynamically, get the lubrication of the joints, get the synovial fluid moving around the joints, and sometimes it's just nice to feel the stretch as you hold the movement statically. So it's up to you. I'll go through the 10 movements. If anything doesn't feel good, then just either stretching one of the poses at the start of the session. Those are kind of more gentle, and those are more if you just hurt your back, or you've pulled a muscle in your back, or maybe you've got like a bulging disc or something like that. So so if you take care to listen, because some of the stretches will strengthen your back, will compress your back, and some of them can become a bit intense if your back isn't very mobile. So try to listen to your body. Okay, so we're going to start lying on our back, and the first stretch is basically just knees to the chest. So we're lying on our back with our head on the floor and just feeling as though we can rest the whole of the spine into the floor. Maybe first of all taking the knees side to side. So we're kind of here ironing out the kinks in our back. So it should feel nice. You could do this in bed if you have a painful back. It's quite nice to do this in bed, or you could do it before you go to sleep. Or it's lovely to do it on a hard floor as well. So from here we can extend one leg along the floor and hug the opposite knee into the chest. So interlocking the fingers and just drawing the knee into the chest. Notice maybe a stretch along the left. If the left leg's along the floor, we'll notice a stretch in the left leg. Maybe also in the right hip. So we want to just soften our shoulders, make sure our shoulders aren't hunched up by our ears. Draw the shoulders down, feel the back resting into the floor. So you could alternate sides, maybe just holding for maybe 10 seconds each side, or you can stay static with the more of a stretch. It's up to you. It's nice for the back to loosen off the discs in the back to keep this movement dynamic. But we want to, if we are keeping it dynamic, we want to be doing the movement slow. Okay, and then bringing both knees into the chest, knees side to side. Okay, so moving on to movement 2. This one is called knees passing. So with this one we have the backs of our hands resting on our forehead, and we're doing kind of bicycle movements with our legs. So we're not letting the legs go too low to the floor, and we're trying to draw our tummy in, making sure our lower back isn't lifting off the floor. If the lower back feels like it's lifting off the floor, take the feet up a bit higher. And again, it's a slow movement, drawing the tummy in, getting that movement in the hips and the legs to help keep the back free and mobile. So we keep going like this for about another 60 seconds. If you want to bring the knees into the chest, have a rest, or maybe hugging one knee and going back to that first move, it's up to you. Try not to be clenching your jaw or your throat. About another 10 seconds. Nicely drawn in tummy. 3, 2 and 1. Bring the knees back into the chest. So hugging the knees in, and from here we're drawing the head up to the knees. So curling the spine up. And then move number 4 is called rolling along the spine. So this helps to iron the kinks out even more and helps us to massage our spine on the floor. So basically we're kind of rolling up and then rolling back. So we've got our hands on our shins, top just underneath the knees, and then we're rolling back and up. So depending how mobile your spine is, this might feel easy or quite difficult. So you could even come right onto your shoulders with your legs behind your head, and then back. So this is movement number 4. About another 60 seconds. Okay, another 10 seconds. 3, 2, 1. And then lying back onto your mat again. Then from here we do segmental bridging. So basically it's a bridge, but we're doing it segments up the back. So first of all we're tilting the pubic bone towards the face, and then segment by segment lifting the back off the floor, and then we're stretching the arms above the head, and then we're bringing the arms back down, and then segment by segment releasing the back to the floor, and try and bring your tailbone down last. So we're pressing the feet into the floor, feet about hip width, knees about hip width, tilting up first, and then drawing the back off the floor, then lifting the arms up slowly. So here as we lift the arms above the head, we're working on our thoracic spine, which is our upper back. So lowering down. When the arms are back down, we're lowering the back segment by segment to the floor. Before we lift the hips again, we're tilting the pubic bone towards the face, coming up as high as we can, and then lifting the arms slowly above the head. And arms back down. So this should feel like a nice stretch for your front of your body, but also strengthening the glutes and the back when we lift up. Lower down slowly. Keep that tailbone lifted right till the last minute. And 2 more. Lifting up slowly. Raising the arms slowly. And back down. Keeping your chin towards your chest. And last one, lifting up. So if you want to work on your breath, we bring the arms down, and we breathe out through the nose as we lower the back down, vertebrae by vertebrae, and then bringing our knees into the chest again, hooking the knees in. So knees into the chest is kind of the foundation movement that we can do after all these strengthening exercises that we do, the back exercises where we're strengthening. Sometimes it's just nice to bring the knees into the chest, or even bring the head up to the knees as well. Feels lovely. Okay, and then slowly back down, and we'll do our rolling along the spine for our, and then we'll come up to seated. So just taking it easy first of all, rolling along the spine. And then with a little bit of momentum, drawing the tummy in, we come up slowly to seated. Okay, so from seated, we do our seated twist. So just remember which leg is in front and try and sit up as tall as you can. So if you have any back problems or knee problems, sometimes it's nice to sit on a block to elevate your hips. If you need a block, that's fine. Okay, so sitting up tall, we're just bringing our left hand to our right knee and our right hand behind, drawing the chest to the right hand side, and then keeping the chin parallel with the floor, just looking over your right shoulder or just looking towards the right. Gently twisting, about 30 seconds. Coming back to the centre, fingertips at the side and stretch up. Deep breath in through the nose, breathing out, right hand onto the left knee and then the left hand behind, just drawing the chest now to the left. Also seeing if you can draw the tummy, chest, shoulders to the left. You can either look to the left or look over your left shoulder. Slowly back to the centre, and then a deep breath in, stretch up again. The breath out, bring the hands forward. So we're walking the hands forward, so we can just look down towards the floor. We can rest our elbows onto the floor as well, and hold here about 30 seconds. Lifting up slowly again, and now stretching out both legs, shake out the legs. We're going to do another seated twist, so just here bringing the flesh from underneath the buttocks, so hopefully you can sit on your sit bones. You can feel that you're sitting up tall, pushing the heels away and toes towards the face, so our legs are strong. Now bringing the left foot so it's over the right knee and hugging the left knee towards the right shoulder, but really trying to lift up tall, keep the spine long. So we can stay here, or we can bring our left hand behind and looking again towards the left. But we want to keep our right leg strong and our spine as long as possible. slowly, hugging the knee into the chest again, lifting the spine, drawing the chest forward, and extending the left leg along the floor, pushing the left heel away, toes towards the face, and drawing the right foot so it's over the left knee. And again, first of all, hugging the right knee in towards the left shoulder. You might feel the stretch in the hip area, the right hip, or the right glute. So these are all linked to your lower back. So we want to do the twist again with that nice long spine. So keeping your chest lifted, now we're bringing the right hand behind, just keeping it close to the lower back, and drawing the tummy and the chest towards your right hand side. Looking towards the right or looking over your right shoulder. Slowly back to the centre, sitting up tall again, hugging the knee in towards the chest. Now extending the right foot along the floor, stretching out both legs, try and push your heels away, toes towards your face. Okay, so now we come into child pose, which is a stretch for the lower back. So if you come onto all fours, take the knees slightly wider than hip width apart and bring the bottom down to the heels. First of all, we're going into extended child pose. So here we're working to stretch out the thoracic spine. So if you walk your fingertips as far forward as they'll go, try to have your hands slightly wider than shoulder width. Then bring your head down to the mat or rest the head on a block. So you can stay in that extended child pose, or we can add a twist by walking your left hand over to the right, bringing the right hand on top of, the left hand on top of the right, and then tilting the chest up towards the left, resting your right ear on your right shoulder. So gentle twist for the spine. Bringing the hands back to the centre. Keep the fingertips stretched forward as much as you can. Now walk the hands over to the left. This time the right hand comes on top of the left, and we're trying to tilt the chest up towards the right. Resting our ear or our head on the left arm. Walking the hands back to the centre again, and press into the hands to lift up slowly. So the next move is two moves together. So it's child pose moving into the Sphinx. So the child pose, we're stretching our back, and the Sphinx, we're strengthening our back and stretching our front. So from here, knees are just slightly apart, and big toes together. So come into child pose, maybe about 10 seconds resting, maybe moving the shoulder side to side or moving the hips side to side, loosening off the hips and the shoulders. And then we walk, we're lifting up, and then we walk the hands forward, resting now on the elbows. Again, we can take the hips side to side, we can rest a bit longer in Sphinx, or we can push back into the elbows, lifting up, walk the hands back into child pose. So it should feel quite nice to do this movement as long as we move slowly, and as long as we remember we're strengthening in Sphinx and we're stretching in child pose. So out of the two movements, child pose, if you have your head resting down, that's the relaxing movement. If you're coming into your Sphinx, that's the more energizing movement. So we'll do about 3 or 4 more, just going at your own pace, maybe breathing out as you go into child pose. And when you're ready to come into Sphinx, we breathe in. And one more, coming forward into Sphinx. So Sphinx is another foundation pose to strengthen our back. If we feel like we need a bit more of a stretch, we can lift a foot, lower down, lift the other foot, lower down, or we can lift both feet. And that's a bit more intense on the strengthening and a bit more intense on the stretching the front of the body. So also from Sphinx, we can go into Sphinx with the bow tie. So this is working our thoracic spine area, the shoulder area. So all we do is stretch the right hand over to the left and the left hand over to the right. And as we edge the fingers away from each other, we feel that opening in the shoulders, and we're just resting our head or our chin on our arm that's in front. And lifting up slowly, then we're just going the other way. So this time the arm that was on top is behind. We're just again walking the fingers away and resting. So about 30 seconds. Maybe try to concentrate on your breathing. Nice deep breaths in and out through the nose. And lifting up slowly and pressing into the elbows. First of all, back into Sphinx, and then lifting up slowly, so we strengthen the back there. Might be quite a gentle strengthening. So going to do one more move on our from all fours. So knees apart, about hip width, hands about hip width apart, and just taking the right foot in between the hands. And try, as you here in your lunge, just try to edge the right toes a little bit forward. So we've got lots of options from the lunge, and they're all great for the back. Any sort of lunge is good for your back because we're stretching the hips, we're loosening the hips, and that's a helps to give us a mobile, supple back. So we'll go through a few options. So left hand stays underneath the left shoulder and we stretch the right fingertips up towards the ceiling. We can bring our right hand onto the lower back and draw the chest a little bit more to the right. We can look over our right shoulder. Just be careful of your neck, or you can just look towards your right hand side. And then we're trying to sink the hips a little bit deeper into the lunge. So again, you can be static or dynamic. So you could stretch up and then bring the hand down, stretch up and bring the hand down. And then the other option, another option of a lunge would be to go from a low lunge and then hand one at a time, bring onto the right thigh. Keeping the hips low, keeping the hips where they are, both hands come on the thigh and we draw our chest forward and shoulders back. So this will help us get our hips lower for a deeper stretch. So the stretch could be in your left quad muscles, your left hip flexors, or it could be in your right hips, right glutes. As we're drawing our chest forward and our shoulders back, we're also compressing our discs in our lower back as well, so a little bit of strengthening. And then we bring our hands either side of the right foot, bringing the right foot back, so up on all fours again and going to our left side. So stepping our left foot forward. Might feel a little bit fragile, we've been in that lunge for a couple of minutes. So we're noticing how the hips feel, how the lower back feels. And we can stay here in the low lunge or we can go into the twist. So now the right hand's underneath your right shoulder and we're stretching the left fingertips up towards the ceiling, drawing the chest to the left. And again, we can bring our left hand onto our lower back and draw that chest a little bit more up to the left. And bring the left hand outside the left foot again into the low lunge. And then we can lift one hand at a time onto the left thigh, keeping the hips low. Both hands on your left thigh, drawing the chest forward, shoulders back. And both hands back, either side of your left foot, drawing the left knee, left foot back. And then we're going to lie down on our backs. So here you can either do knees into the chest, finish with that foundation move. And take 10 breaths in, knees into the chest, or we can do what we call reclining twist, so feet down on the floor, knees together, feet together, and slowly take the knees down to one side. Feel the stretch up the, so if you're taking your knees down to the right, you feel the stretch in the left hips, maybe the lower back, and then knees to the centre, and knees down to the left side. So again, you can be static, you could hold for 5 breaths each side. Or you could be more dynamic, taking the knees side to side, but breathing to help with the relaxation, help with the reduction of inflammation. So reducing inflammation, if we can breathe deeply helps, especially if you feel tight and tense. Breathing deeply helps the rest and digest system. Okay, so thank you for joining. So to finish, it's quite nice just to stretch the arms all the way above the head. Take a deep breath in. And slowly bring the arms down, and then work on any of those movements that we've done, but it's quite nice to finish with knees into the chest, or knees to the foot, head to the knees, and lifting up slowly. Okay, thank you. So you could stay just lying on your back if you need a bit more just relaxation, or move around, get on with your day, and thanks for watching. See you soon. Bye.